Good morning, everyone. Welcome to the Miller-Johnson webinar this morning. This is Sarah Willey, and I'm here today with my colleague, Sandy Andre. And this morning, we are going to be presenting our third and final part of our MIOSHA in COVID safety series. So welcome. This is the third part in our COVID series. 2 weeks ago, we talked about the MIOSHA enforcement and the general duty clause. If you're interested in more information on that, that was on July 14th, and you can find that on our COVID resource page. Last week, we covered the 3 R's: reporting, recording, and records. That was on July 23rd. And today, we're going to be talking more specifically about OSHA or MIOSHA standards that are applicable to the COVID-19 pandemic. So what existing standards do we need to be thinking about in times of COVID? And in particular, we're going to be focusing on PPE, respiratory protection, sanitation, and hazard communication. And Sandy is going to be the one talking to you guys about all of those things, and then I'm going to be in the backdrop here keeping track of questions and answers and fielding those. So with that, Sandy, go ahead and take it away.
Very good. Well, good morning, everybody. As Sarah mentioned, today we're going to spend our time talking about the remaining existing standards that exist under the MIOSHA and OSHA umbrella that may be applicable to our COVID-19 life. You may remember, if you're joining us, if you've been along with us on the series, that one of the things we talked about in our first presentation was talking about, okay, how do I maintain compliance from MIOSHA's view? How are they going to measure compliance in this space that we are in? And we talked about that they had issued an enforcement plan that specifically identified a handful of standards that they would be monitoring compliance with, of course, as well as turning to federal OSHA guidance and CDC guidance. So the topics we talk about today just continue on that theme. The good news, I know that from time to time we have folks on the call who are from locations outside of Michigan. Most of the MIOSHA standards we're talking about today generally almost mirror the federal OSHA standard on these topics. But certainly from a MIOSHA standpoint, they are borrowing heavily from federal OSHA guidance related to how these standards come into play during the COVID-19 pandemic, and of course, CDC guidelines. So much of what we will talk about today is generally applicable, and that's good news for those who have folks in multiple locations. So our first topic, the PPE standard. So let's first talk really quickly here that PPE, cloth face coverings, are not considered PPE covered by the MIOSHA standard, okay? So for those of us in Michigan, or if you are in another state with a mandatory cloth face mask requirement, don't think that now that you have to wear that at your workplace, or you have to provide those to your employees in the workplace, that you've automatically kind of leapt into being covered under the PPE standard. That's not particularly true. So wanted to start off with that right away. But let's just generally talk about what the PPE standard is all about. Generally, the standards we talk about today, at the heart of all of those are really kind of this hazard assessment, which hopefully most of you on the call who are back up and running doing in-person operations are pretty familiar with, because as part of your COVID-19 preparedness and response plan, you were required to identify the low risk, medium risk, high risk type of jobs or facilities within your organization umbrella and talk about how you were going to mitigate the risks in those particular places. So as we talk about the standards today, kind of going back to your initial hazard assessment for those jobs is particularly important because what PPE might be required for me, right, Sandy Andre sitting at my desk at Miller-Johnson, is a lot different than what the PPE might look like for me if I'm out on the manufacturing floor in a much more densely populated area in this time of COVID-19. So that's always the first place to start, right? As under our occupational safety and health standards, as an employer, we are required to assess our workplace and determine what hazards are present or what hazards are likely to be present that would require the use of PPE. And so here we're talking about, again, something more significant than the cloth face coverings. We're talking about goggles, gloves, welding masks, right? Under our normal PPE world, those are the types of things that we're talking about. Okay, and so to do that assessment and then make a determination, right, based on the type of work that's being done and the hazards that are present for any particular type of worker based on the hazards that they might be exposed to, then of course the employer is obligated to select the appropriate PPE that will protect the employee from that hazard. Of course, require your employees to use PPE that will protect them from whatever hazard you've identified they need it. Communicate to your employees the selection decisions you've made, right? So, hey, employees, these are the hazards that are present in your workplace. We've selected XYZ PPE to keep you safe, and these are the situations where you must wear that PPE. And then, of course, also incredibly important, it's just not the PPE that's going to keep somebody safe from the hazard, but you've got to take into account the job that the person is doing, right? So the PPE that you select has to be designed or constructed in a way that it is safe to be worn for the work that's being performed, okay? And so once you've done all of that, then there is this training requirement, right, that you need to communicate all of those decisions back to your employees. Tell your employees when it is necessary for them to wear those pieces of PPE, what kind of PPE is necessary in which situations, right? You may have a whole spectrum of job duties that people may go in and out of all day long, or even kind of from a disaster preparedness standpoint, right? Maybe there's a PPE protocol that you hope folks never have to use, but it's certainly possible in the type of work that somebody is charged with doing or the type of work that your organization does, that it can come up. So making sure that your employees understand what kind of PPE is necessary in each particular situation, training those employees on how to properly take on, take off, adjust, and just generally wear the PPE. Communicate to your employees the limitations of any particular piece of PPE. So, hey, employees, this is the hazard and this is the piece that's going to protect you as much as possible from that hazard, but you absolutely can't use it like this because here's a limitation to it, or you must care for it in this particular way or it becomes compromised, whatever those pieces are. And then, of course, training related to proper care, maintenance, useful life, and disposal. Those are all really important pieces. And a significant piece that comes with the training requirement that I'll kind of just speak anecdotally to is kind of this retraining requirement, right? So it's not as good as, and this isn't anything we do, not just PPE, but particularly under MIOSHA, when it's not just good enough, right, for us to say, okay, new employee, thanks for coming, here's all of the equipment, this is how we expect you to use it, and we kind of go down this little checklist here. But when we have reason to believe that there are gaps in that individual's knowledge, right, and maybe it's because we see them not wearing it when they should be wearing it, we see them wearing it improperly, all of those pieces, there is this retraining requirement inherent in the PPE standard as well. And I will tell you anecdotally, as we look at general MIOSHA citations and what I would say is kind of the before COVID times, this kind of lack of retraining piece is often kind of thrown into that inspection report, right? So yes, employer, I know you had the program and I see your training program and I see the employee signed off on the checklist, all of those pieces, but I generally observe them doing this incorrectly, and so that tells me that there's a gap in their knowledge, and so some retraining here is required. And certainly there are other times when retraining would be required too. So for example, if you are changing the type of PPE that you're using, right, that the previous training you would have provided is no longer makes sense or is obsolete, or you're making some kind of significant change in your workplace that renders any kind of previous training you gave to be obsolete, those would also be triggers. So kind of that training and retraining requirement, and generally the responsibilities of the employer, right, is that the employer needs to provide the PPE and it can't provide damaged or defective PPE. And from an employee standpoint, the responsibility is even maybe a little bit easier, right? They just need to properly use the PPE that their employer has provided to them. Next slide, please. So the good news in all of this, I will say, is that there are a couple of excellent resources as we look specifically towards PPE and how this might impact your workplace during the COVID-19 pandemic. OSHA has developed interim guidance for specific worker groups, and what I've pulled up here in this slide is just one worker group. It's for those working in a dental office, is just the example that I pulled. But you can see here that it gets very specific, and this is really, really helpful. And so MIOSHA has told us that they are enforcing their own PPE standard, the one that we just talked about, but they're leaning heavily, right, on federal OSHA guidance and CDC guidance in all of these particular areas. So it would serve us well here in Michigan to become familiar with those federal OSHA recommendations or federal OSHA guidelines because we know that that is what MIOSHA is going to hold us to. So as I said, this is actually really helpful. Even in this particular example, it really breaks down what exact PPE we're talking about and when that exact PPE should be used. So again, we're not talking about cloth face coverings. We're talking about something above that: gloves, gowns, eye protection, in some cases, N95 filtering masks, all of those pieces. And so I would encourage you to take a look at the federal OSHA guidance and look up what is appropriate for your particular workplace. If you're just, I shouldn't say just, but if you're just generally in an office building, right, like me, the interim guidance is going to be pretty low, right, unless there may be additional PPE that is recommended if you have significant interactions with the public or a particular population of folks that you suspect or are confirmed positive. You know, there will likely be additional PPE requirements, but absent that, it's going to be just some of the general things that we see that we don't necessarily consider PPE, but some of those safeguards that we find here in Michigan that come out of like Executive Order 145 as an example, okay? So as an employer, we should be looking to the latest OSHA and CDC guidance, including PPE selection is what MIOSHA is telling us. And next slide, please. If as you're listening to this, you're going, I have no idea where I can get PPE, how I even go about doing that. The good news here again is that on the MIOSHA Workplace Safety page, they have a section, where can my business purchase PPE? And it's essentially a database, right? It kind of flips you to a different business group. But if you are somebody who is in need of PPE, they ask for some of your information, for example, your location, how many employees, what type of PPE you're looking for, and provide you access to a database of suppliers who may be able to fulfill that need for you. On the other hand, if you happen to be a supplier of PPE and you want to make sure that folks who might be going to this place know that you are somebody that they could purchase PPE from, there's also the ability for you to be added to the supplier database. So all of that is good news. Okay, let's go ahead and move on to the next standard. So we just got done talking a little bit about PPE, and now we're going to go ahead and move on to the respiratory protection standard. And similarly to how I started the conversation on the last section, talking about how cloth face coverings are not considered PPE from a MIOSHA safety standpoint, when we are just generally talking about face masks. And sometimes we all use these terms, right? Sometimes I don't say cloth face covering, sometimes I say mask. And depending on what kind of mask I might be talking about, you might think that means something that I don't think, that I'm not intending it to mean. So I just want to be really clear that not all masks, certainly not cloth face coverings, do not automatically become kind of covered under MIOSHA's respiratory protection standard. So it's very unlikely that you accidentally stumble into being covered under this standard necessarily. And we won't spend a ton of time on this graphic, but just know that it is up. This particular graphic is up on the workplace safety website, and so you can take a look at that a little bit further to understand a little bit about the requirements between cloth versus surgical versus filtering face pieces. Let's go ahead and go to the next slide. The big piece with the respiratory protection standard, again, starts with a hazard assessment. That's always going to be the first place that we want to start. Again, as you're going through and you are looking at the jobs and your work environment, and you're making a determination that respiratory protection is applicable to your particular workplace, because you have employees, right, that may be breathing air contaminated with this virus, okay? And so we're generally talking about folks who have some exposure to suspected COVID infected persons or confirmed protected persons, right? So generally we're talking about those in somewhat of a healthcare capacity, but that certainly isn't all the time. So once you've made a determination that that hazard exists in your organization, you as an employer are required, right, to implement something that abates that hazard to the extent that you can. And so generally, whether that's a respirator or something covered under the respiratory protection standard, will determine exactly what kind of what pieces of the standard apply to you. And you and I might say respirator, and we have a vision of our mind and what that might mean, but there are multiple different types of respirators, right? So air purifying respirators, powered air purifying respirators, respirators that are supplied air respirators, or even, right, self-contained breathing apparatus, SCBA, right, those pieces. So there's a big spectrum here, right, and they can, in terms of size and look, some are, a quarter mask or a half mask, some include a helmet and a hood, all of those pieces, okay? So the respiratory protection standard walks through, okay, if I am in this, if I have employees who have access to this particular type of hazard, this is the type of respirator that's appropriate. And because I've selected, for example, a powered air purifying respirator, these are the pieces that I need to do to make sure that it's safe for me to have those in my workplace. So again, it's all kind of starting, right, with that hazard assessment. So once you've done the hazard assessment and you've determined that, cloth face coverings are not going to properly abate the hazard, or even the non-surgical medical masks, as an example, aren't going to abate the hazard, and you kind of transition into something that would be covered under this respiratory protection standard, the biggest piece of the standard is development and implementation and monitoring of the requirements of a written respiratory protection program. And so the good news about a written respiratory protection program is right on the MIOSHA website, they actually have a template of all of the pieces that might be included in your written respiratory program, and it's kind of a fill in what applies to you, remove what doesn't, as long as all of the basic pieces are there. So for example, if you are just simply doing an air purifying type of respirator, you're going to remove the whole section that talks about self-contained breathing apparatus type of respirators. That's just as an example. But this is, you don't have to reinvent the wheel here, I guess is what I'm trying to say is the good news. And it walks you right through these, as we look at the bullet points here, these are all required pieces. So it prompts you to articulate the procedures you've used for selecting the respirator for your workplace. And again, this is where the OSHA and CDC materials are very, very helpful because in the example we just looked at, right, when we were looking kind of at the dental office type of workplace example, when we were talking about PPE, you may have noticed in that chart that N95 filtering face masks were included in there. And so, right, the good news / bad news is we may all have we might not have done the hazard assessment necessarily, but in this time of COVID, now federal OSHA or the CDC is saying, hey, people in these jobs doing these types of things need N95 as an example, and along with N95 kind of comes that's a type of face covering, face mask, respirator that falls under this respiratory protection standard. So generally, as you're listening to this webinar, this call, you've got the resources to say what are those pieces of PPE that I'm required to use? Okay, are any of those pieces of PPE trigger my obligations under the respiratory protection program? And if they do, how do I implement that, right? So maybe your procedures for selecting the respirator for your workplace in this COVID time is simply because even though you wouldn't normally be doing it, right, but OSHA and the CDC have said that that is what is going to keep your employees safe, and that's perfectly appropriate, right? But there's some additional work that goes along with that. Each employee that you have who uses a face covering that's covered under the respiratory protection standard is required to have a medical evaluation to make sure that they have the ability to use that face covering safely, right? So because generally some of them require kind of a tighter seal and all of those pieces, there may be folks with some medical contraindications who can't do it. And so that's an important piece to have built into the protection program. Also, the very good news about that is you go on the MIOSHA site and you look at their sample written respiratory protection program and the materials that they have a sample medical evaluation form, right, that you literally can just take this form and send it, right, with your employees to whoever you're having doing that medical evaluation. You know, if you partner with somebody from an occupational health standpoint to do those, again, not having to reinvent the wheel here. So you do the medical evaluation to make sure that your employee who needs to wear one can medically tolerate doing so, and then you engage in some fit testing procedures for those respirators that are required to be tight-fitting, so that employees, so you can get the right fit, employees understand what that's supposed to feel like. You train them on procedures for proper use. You train them on procedures for cleaning, disinfecting, storing, inspecting, repairing, discarding, and general maintenance. You develop and train on the procedures for employees to ensure adequate air quality, quantity, and flow, right? What they should understand as being the proper use and everything is working correctly, and have a recognition of when things are not working correctly, that they understand and know the difference. And then, of course, that training requirement that we've already talked about, you're going to kind of follow those same general broad PPE type of categories and how and when to use it, how and when to take it on and off, adjust, how and when to clean it, all of those pieces. And then, of course, you are building in procedures for you as an organization to regularly evaluate the effectiveness of the respiratory protection program, right? So our employees doing it and following it and all of those pieces. Does that hazard still exist in our workplace, right? Maybe, hopefully, not too far in the distant future, you know, the current state of the pandemic looks very different, and we can start to get away from some of these pieces for the environments and the jobs that hadn't traditionally always required them. And so those are important pieces, again, just because you kind of fall into the respiratory protection standard today doesn't mean that that's something that you will be doing long term. And so it's appropriate for you to continue to evaluate that hazard. And again, leaning on federal OSHA guidance and CDC guidance in this area is particularly helpful because that'll be a really good signal of when you can step back on those areas. Next slide, please. Now let's generally talk about what may seem strange, but this came up more in the very beginning of the pandemic. I haven't heard as much about it recently, but there are actually requirements that an employer has to follow if you have employees who, although you've done your hazard assessment, right, you've checked federal guidance, you've checked CDC guidance, and none of them are saying that you need to provide, you know, a type of PPE that would be covered under the respiratory protection standard, but you've got an employee who wants to wear something that would fall under that protection standard if you were requiring it yourself. And in those situations, you have the ability to say yes, but there are still some obligations that you must fulfill. So first, remember we talked about the first question is kind of always that hazard assessment. You can say yes as long as you've made a determination that an employee wearing that respirator does not create an additional hazard itself, right? So depending on whatever type of job it is and that the employee, you know, you have a general understanding that the employee is using it correctly, all of those pieces, you have the ability to say yes. However, you're also required to provide you're required to provide voluntary respirator users information contained in the MIOSHA standard. It's called Appendix D. And essentially, what that is just an acknowledgement from the employee that they understand that they are now responsible for understanding and following the manufacturer's recommendations on use, maintenance, cleaning, and care, and becoming knowledgeable about warnings related to any particular piece of equipment's limitations. So remember, right, when you were requiring it as the employer, there were all those pieces you needed to have in your respiratory protection program and the training that you needed to do. But if an employee wants to wear one on their own and you are wanting to allow them to do that, there is some acknowledgement that the employee needs to do, because now all of that kind of falls on the employee's shoulders, right? So, hey, employee, just so you know, it's fine for you to wear it here, but we're not monitoring that, and it's your responsibility that you're wearing a piece of equipment that if we required you to do so, we would be obligated to provide you a handful of things, but now those are all your responsibility to make sure, right, you're able to wear it, you're cleaning it properly, you're wearing it properly, all of those pieces. So that, again, I haven't heard about that for a while, came up in the very beginning of the pandemic, I think, right when we had employees who wanted to just wear, you know, N95 masks. This is well before here in Michigan, our executive order that required cloth face coverings, but it is still applicable in the event that you have an employee who makes that request. Let's go to the next slide. In terms of respirators or pieces of equipment that fall under the respiratory protection guidance, I would say that OSHA, federal OSHA, has been particularly active in this area in terms, and when I say active, I don't necessarily mean issuing citations, I mean in issuing additional guidance about how they are going to enforce this standard. And the good news is that as I look at all of these pieces of enforcement guidance in totality, the really good news is that there absolutely is a recommendation from OSHA that getting these pieces of equipment might be extremely difficult for employers, even if, right, they've said, hey, these are the employees that need to wear them. Employers, make sure you're doing it. There is a recognition here that there are going to be shortages in supplies, and generally respirators covered under the respiratory protection standards have to be procured from very specific types of manufacturers, those that have been certified by MIOSHA as an example. But in all of these enforcement guidance pieces that are listed here, they've put out some guidance that says, hey, if you can't get these types of respirators, these ones will do for now. And that includes respirators from other countries. As long as they're certified under these types of standards, they're okay to use. And for now, we'll consider you in compliance with the respiratory protection standards. So that's generally what those pieces are. Also, again, guidance related to the N95 shortage and what particular employees should do in those types of situations, right? So generally, there are certain types of jobs that they say, yes, this type of job is exposed to this type of hazard and they need to be wearing N95s the whole time. And I'm speaking very broadly. But there's guidance here that says, however, employer, if you are in a shortage, this is how you can maintain your supply, and this is how you can start to peel back who gets those in the interim until you can procure more. So for those of you, particularly those of you who might be using N95s, there is a ton, like I said, of enforcement guidance that OSHA has issued, and I would encourage you to become familiar with those. Again, taken in their totality, it's a recognition that they're changing some of those pieces, right? It's okay to get them from a different type of manufacturer. It's okay to, when you're in a shortage, to not supply them to everyone or to kind of funnel their use in this type of way. It's okay to forego annual fit testing for N95. You still have to do your initial fit testing for brand new employees or brand new wearers. But if your employee comes up for annual fit testing at this point during the pandemic, they're going to say, you know what, as long as you don't have any reason to believe that, it is not fitting them, we're going to, kind of put a pause on that. All of those pieces. So rather than kind of going through each of them in their totality here, I'll just say, particularly if you are a workplace that's requiring N95s, I would point you to these pieces of guidance and encourage you to become very familiar with those. Okay, let's go ahead and move on to the next two standards. They almost go hand in hand, even though it might not seem like it. So we're going to start with sanitation, then we're going to talk about hazard communications. So generally, the sanitation standard includes things like if you are an employer, you have to have an appropriate water supply and provide toilet facilities and washing facilities, and if you do these types of jobs, you need to provide change rooms and clothes drying facilities. You have to have rules related to where food and beverage can be consumed, and if you are kind of a food handling type of employer, there are particular rules on how that must be done, all of those pieces. And so I would say that generally most of us don't think about this standard in our day-to-day life outside of maybe folks who are doing some of that food handling, food preparation piece. And where it generally comes into play as we look at this through the COVID-19 lens are going to be, right, our new requirements related to general cleaning, hand hygiene, and just general housekeeping. So let's go ahead and go on to the next slide. So what has MIOSHA or federal OSHA or the CDC said about general cleaning, right? So generally they have said employers continue with your routine cleaning and regular housekeeping practices and begin, right, to clean and disinfect potentially contaminated environments using these EPA registered disinfectants. okay? So encouraging us to do all of those routine things, but in the event that we have a confirmed or suspected case in our workplace, we may want to do a little bit more, right? And we know that a little bit based on what we know about how COVID is transmitted, right? So when people touch a surface or an object contaminated with COVID, and then they touch their eyes, nose, mouth, all of those pieces, they expose themselves. And so the thought, right, is if we can clean, which is kind of the removing germs piece, and then we can disinfect, which is the killing any of the germs that remain, we can stop the spread. That's the piece there. And we can know at this point, right, we know that the virus can survive on certain types of surfaces for, hours to days. And so making sure that we're engaging in that regular cleaning and even stepping that up to a disinfecting type of situation during this time is what's appropriate. So generally what the CDC is telling us, continue on your regular routine cleaning and housekeeping practices in any of your facilities that remain open to your workers. And then you should be cleaning and disinfecting environments that are potentially contaminated, and the types of chemicals you should be using to do that are those that are EPA registered to the extent that you can. And then, of course, any of your employees who are conducting that cleaning, if this is a new type of duty for them, or these are new chemicals that you're using that you haven't used before, again, we start back with kind of that hazard assessment, right? What is this new hazard? So what are these new chemicals that my employee is now coming in contact with? What PPE do I need to provide to them to protect them from any type of exposure to those chemicals, so on and so forth. So that part is pretty straightforward. Next slide, please. And so again, what we know is that the CDC and OSHA are good, federal OSHA, I should say, are good one-stop shops, or are good reference points on this. MIOSHA has told us that they are looking to both of these agencies to provide guidance here. And so generally, federal OSHA has said, has pointed to the CDC, right? And it says, hey, the CDC has actually provided the most updated information on how to clean and disinfect workplaces. And they've kind of got this three-step plan that talks about developing what your plan is going to be, implementing your plan, and maintaining and revising your plan, kind of this plan, do, check, act type of cycle, if you will. And so generally that means as you're developing your plan, determine what needs to be cleaned, right? So what areas of your workplace are occupied, what are indoors, how are you going to clean outdoor areas, determine what areas just generally need to be disinfected. So what types of surfaces are kind of some of those high touch surfaces, and does it make sense to do more than regular cleaning there, but disinfection? And then consider what other resources or equipment you might need, from those EPA registered chemicals to just manpower, right? And then in terms of the second piece of implementing your plan, of course, right, we're going to clean visibly dirty surfaces with soap and water prior to disinfection, then use the appropriate cleaning or disinfecting product. And then in terms of implementation, using the product as it's intended, as it's listed on the label, following those instructions, storing it properly, all of those pieces. And then, of course, maintaining and revising. Continue those routine cleaning pieces and routine safe practices, but remain flexible and kind of agile to be able to respond to potential exposures. And so thinking about those pieces. And then, of course, hand washing is particularly critical, right? And so we know this. We're training our employees, or trained our employees when they came back to work about this, about the proper techniques for hand washing, and we're making sure that we're giving them time to be able to do that. So, right, soap and water for at least 20 seconds, especially after you've been in a public space, or after blowing your nose or coughing or sneezing, especially important before eating or preparing food. right before touching your face, after using the restroom, after leaving a public place, after caring for someone who is sick, all of those pieces. And then where, right, there may be work environments where soap and water might not be readily available, but that's where the hand sanitizer that contains at least 60% alcohol comes into play. So the sanitation standard is generally pretty straightforward. If you're doing in terms of what you've laid out in your preparedness plan, a backdrop that kind of follows those CDC guidelines, you're likely in really good shape. Next slide, please. But what goes hand in hand with that then, as we talk about maybe stepped up types of cleaning and disinfecting, I kind of teased it a little bit, is making sure that you are compliant with the hazard communication standard. And so the hazard communication standard generally requires you to ensure, right, that the hazards of all chemicals that you have, that your employees are exposed to, that you're doing an evaluation of those chemicals and information related to those hazards are provided to the affected employees. And so so those of us that probably generally know a little bit, right, we know safety data sheets, SDS sheets, those are the things that might come to mind. If there's a particular chemical in our workplace that we're working a lot with, we know that it's the Michigan Right to Know law and the hazard communication standard requires that that chemical has a proper label, that my employer has a safety data sheet that tells me about that chemical, and I have been provided some training on how to interact with that chemical, proper uses in the event that I become exposed to it in a way that's out of the ordinary, right? So it's in my eye or I inhale it in a different way, all of those pieces that SDS sheet is going to walk you through the appropriate response. So generally what you want to do here, if this is something that is new to you, and you've never had general, this hasn't been something that's been generally applicable to you, you're going to want to identify a responsible staff person who is kind of the keeper and the coordinator of the safety data sheets, who is kind of a touch point for training your employees on safe use with those chemicals. And then you're going to want to prepare and implement your written hazard communication plan. You're going to want to explain how hazard communication will be addressed. So when a new chemical comes into the workplace, what is the process for making sure it's appropriately labeled, making sure you have the safety data sheets, making sure that folks who are going to be using it or exposed to it are training on it, and making sure, right, whoever kind of this responsible employee or employees in your organization are going to be the ones in charge of kind of having an inventory and a list of all the hazardous chemicals in the workplace, and knowing where those are and what your procedures are for maintaining safety data sheets, providing information to the employees, and making sure that you have procedures for labeling chemicals. And then informing and training your employees, we've been through that a little bit, but then of course evaluating and revising any of your protocols to address change conditions, right? So here we are in the pandemic. That's certainly a change condition, again, that many of us maybe didn't have very many, if any, types of these chemicals that might even fall under this hazard communication standard in our workplace, but now we do because of the way that we're stepping up our cleaning, disinfecting, and sanitization. So making sure that any of those chemicals that are coming into your workplace you have accounted for and are doing all of those pieces. Okay, last slide, one more. When we talk about a couple of final thoughts on, as we look at just generally MIOSHA compliance generally, I want to make you aware of a couple of developing pieces. First, just this week, MIOSHA announced a safety grant program that they've announced where employers have access to kind of a matching type of system grant program to help them related to kind of almost anything related to the COVID-19 pandemic. Generally, it's related to some of the controls that employers need to put in place. So whether we're talking about engineering controls or administrative controls or PPE procurement, all of those pieces, they are making grant funds accessible. And so there's an application process that you have to go through, and you have to attest to the fact, depending on your organization's size, and that's measured in employees, you may be required to attest that you will match up to a certain amount of the grant that you receive to be used for these for the pieces that you request, all of those pieces. So we included the link there so that you can go check that out a little bit more and see if that is something that might make sense for your workplace. But we thought we've got the audience to definitely send that message to today. The second piece that I want to make you aware of, I think it's really important that we all kind of stay on top of watching for developing standards. So I haven't necessarily gotten word of anything right here in Michigan, but I know that there's lots of conversation at the federal level with various groups trying to encourage the Department of Labor, which is kind of the over umbrella of federal OSHA, to issue kind of a temporary emergency standard specifically related to the COVID-19 pandemic. And they haven't thus far, but just last week, the state of Virginia adopted the nation's first COVID-19 workplace safety mandate in their state. And so, as I know, we've got folks on the call who are from all over the country. And so it's always really important to be continuing to watch for standards that might be developing in areas where you have employees that those might apply to. And then the last piece, and we've talked about this in a couple of our previous presentations, but know that we are starting to see increased enforcement action related to the COVID-19 pandemic, and that is a broad range, right? It can be a big spectrum of types of activities that are being investigated and things like that. But just recently, federal OSHA issued a citation to a workplace in Ohio that was specific to that employer's purported failure to comply with the respiratory protection standard because of their failure to maintain a written respiratory protection program. So just wanted to make you aware of some of those happenings. But in terms of content, we have now covered all of those pieces. Sarah, do we have any questions?
Yeah, we have just a few, and Sandy, thanks so much for all of that information. I found it very helpful. So we have two questions, and I think you might have answered them at least in part during your presentation, but let's go over them again. The first one is, are N95 masks part of the respiratory protection program?
Yes, so an N95 mask is considered a respirator under OSHA standards. And so if you are requiring N95s, right, because they have that tight seal piece, you've kind of now fallen into being required to follow the requirements of the respiratory protection standard. Yes, exactly.
And that involves training and other things, correct?
Yep, absolutely.
Okay. And then the other question is this: how is MIOSHA or OSHA enforcing the use of N95 requirements in interim guidance for certain industries without amending the standard itself? In other words, do they have the ability to publish these interim guidance without changing the standard itself? And I think the answer to that is yes, because the guidance relates to particular facts and circumstances that are present with COVID. In other words, the guidance is meant to shed light on the executive standard. I don't think, and you can tell me if I'm wrong, Sandy, I don't think the guidance that's been issued contradicts the existing standard. Am I right about that?
Yeah, you're absolutely right. And in fact, most of the guidance that they've issued from an enforcement standpoint, right? So when we talked about those enforcement memos, are actually relaxing this standard a little bit, understanding that a whole bunch of folks have now kind of fallen in to this standard who never did before, right in the midst of a shortage for the things we're now saying that everybody needs.
Right.
So from an enforcement standpoint, I think they've been very fair on that point. In terms of the other side of that question, right now, for all of the people who've now leapt into needing to supply these when they never had before, remember that the standards generally don't say, if this is your job, this is the PPE you need. I mean, there are some, right, that are very clear, right, that, if, you know, for example, if you work on a roof with this kind of pitch, you absolutely need fall protection. But generally, remember when we talked about that the starting place is always the hazard assessment.
Right.
And so the hazard assessment talks about what hazards are in your workplace, and if certain hazards are in your workplace, these are the types of PPE that you might need, and those might be respirators. And so now in this place of COVID, that's the hazard that might now be in the workplace and be involved with people's jobs in a way that it never had before. And so that's kind of the mechanism of saying we can't turn our eyes off of this new hazard that's here. And so employers, we're just helping you make that decision to say these are the jobs that need these pieces, right, rather than putting the onus on the employer to do it themselves. So, right, I get it. That's a teeter-totter of good news, bad news, but that's kind of the mechanism.
Right, right. So it's not so much the rules or the standards that have changed. It's just that we have this new hazard in our communities and workplaces that hasn't been here before, right? So as employers, we're seeing some additional obligations. That makes sense. We just had one other general question from registration, and I think we may as well answer that because we have a few minutes. And that is, if you're exposed to a confirmed case of COVID, do you still quarantine for 14 days? And this is such a fair question because I know the CDC recommendations have evolved over time. We have executive orders in Michigan, and man, is this stuff hard to keep track of. And it can vary by state too. So Sandy and I both know a little bit about this. I'll start with this, Sandy. I know in Michigan, we do still have Executive Order 36 that's effective through the current state of emergency. As of now is in effect through August 11th. We can probably all take an educated guess and say it's going to go beyond that. And Executive Order 36 says if any person has been in contact with a known confirmed case of COVID or anyone with one of the primary symptoms of COVID, they are required to self-quarantine for 14 days. So I know that's true in Michigan. What else do you know about that, Sandy, from a CDC standpoint that might apply to other states?
Sure. So from the CDC standpoint, remember they have some guidance that talks about certain types of environments that folks who are close contact folks, so not folks who are positive tests themselves, but may have different or relaxed requirements. So generally that's folks in healthcare, that there's kind of a carve out for them. There's also a carve out for some type of critical infrastructure type of settings. And so several other states are relying on that particular CDC guidance to say you follow, right, if you happen to be a healthcare person or a critical infrastructure person or none of the above, whatever bucket you fall into, you follow whatever the CDC says on that. But then again, there are also some other states that have something different than that, right? We've seen that through their executive orders as well. And, you know, we're hearing kind of anecdotally, even here in Michigan, that that as employers are kind of going through kind of the notification right to local public health officials, if, for example, if I have a confirmed case, if we have a confirmed case here at Miller Johnson and we're making that communication to local public health officials might be giving us guidance on what, you know, anybody in our workplace who could be deemed a close contact, what they are recommending. But Sarah is absolutely right. Executive Order 36 is still on the table for all of us here in Michigan. And
right.
Absent the very specific carve-outs there, that is the public policy of this state.
Right. And I think that emphasizes something really, really important for businesses, and that is if businesses have operations in more than one state, it's particularly important right now with regard to COVID to know what the requirements are in the state for which you have a question or a situation, because they really do vary greatly based on the state that you are talking about.
And even I'll just throw in even the county, right?
Yeah.
So
good point.
Some of that's gone away here. Yeah, some of that's gone away here in Michigan, probably because of you know, the volume of state executive orders, quite frankly. But in other states, that's not at all the case. That the county orders are going to be more stringent than the state orders for various reasons. And so it's really important for you to have a good ear to the ground of what's happening locally where you have your operation.
Yeah, excellent point. So, all right, well, we answered all the questions. Oh, well, we were talking, it looks like we got a few more. Are you up for 2 more questions, Sandy? You've got a
Sure, of course.
All right. I'm reading them. Let me see if I can rephrase them. Can the county ask us if our employee who was close contact is at work or if they are in quarantine? Great question. So I think what that person is asking is it confidential information somehow? Is somebody's status at work or at quarantine confidential such that HR shouldn't tell the county whether they're working or not? I think not. In these unique circumstances of COVID, I'm comfortable with a business telling the county that whether somebody has been at work or whether they have not been at work, so that the county can assess risk and do what they need to do from a contact tracing standpoint. Sandy, you can disagree with me on that. These are questions, quite frankly, that are novel and new, so I don't mind anybody disagreeing with me.
Nope, I totally agree with that. I think, you know, communications on these pieces with your public health officials related to their contact tracing efforts are definitely, you're going to be allowed to do that for sure.
Yeah. And then one other question, what should be done when workers are testing positive for COVID and then a few weeks, a month later, they are testing positive again? Yeah, we are seeing a lot of that. People and even with individuals who are non-symptomatic, right? So they might have been tested because they had close contact, they tested positive, and it's taking a really long time for that virus to get out of the person's system, and they keep testing positive. There is nothing that you can do. There's nothing to be done about that. They are positive for COVID, and as we understand it right now, if they are in your workplace, they could very well transmit COVID. The CDC has not established a timeline by which somebody might be testing positive, yet not be spreading it, unfortunately, or shedding that virus. Anything to add to that, Sandy?
Nope, I would just say every time, right, you get notification of a positive test, you kind of rerun your positive test protocol piece, right? And so this is where the daily entry screenings are really critical, and making sure that folks are doing those and answering those honestly in terms of symptoms. It's obviously harder with asymptomatic people, right, because certainly they're answering those questions honestly, but just making sure that you've really buttoned up some of those pieces. But as Sarah said, the only thing to be done is just to kind of rerun your protocol. And in Michigan, under Executive Order 145, it's really clear the circumstances on when such a person can even return to work, right? So just keep rerunning that. Keep doing your notifications to the Public Health Department each time. Keep doing some of the internal contact tracing related to who and where in your workplace that person may have been had access to and may have exposed others.
Yep. Okay. And that was Executive Order 115. Sandy, is that correct?
I think it is now 145.
145. Yeah.
If I remember correctly. Yep.
Okay.
The mask order is 147. The workplace safeguard order is 145. Yep.
Right. And just to be clear, Executive Order 36 is mandatory for all businesses in Michigan, except there is an exception for healthcare, for certain healthcare employees, right? I'm getting the same question. Well, do we follow Executive Order 36 and the CDC or the CDC recommendation? If you are a business to which Executive Order 36 applies, that is mandatory, okay? That trumps the CDC's recommendations. The reason it trumps it is the CDC's recommendations are just recommendations. They are not binding in the way that Executive Order 36 is. Okay. Always fun to talk to a great group about our latest and COVID questions and concerns. So thank you all so much for joining us this morning. And please have a safe day and stay healthy.
Thanks a lot. Bye-bye.